Blood Bank Guy Essentials 015. Hi everyone, this is Dr. Joe Chaffin. Welcome to Blood Bank Guy Essentials 015. This is kind of a bonus podcast, kind of a surprise to tell you the truth. I did this podcast today, July 31, 2016, just primarily in response to a load of questions that I'm getting on the website regarding the Zika virus. Many of you are aware that Zika has been discovered to be locally transmitted, or identified to be locally transmitted in an area of South Florida just a couple days ago. And so since I'm getting so many questions, I thought I would just kind of take you through this with my co-host, Dr. Heidi Chaffin, and just give you the basics and the nuts and bolts of Zika, in particular how it relates to blood transfusion. If you're in the blood industry, I guarantee you this will be too basic for you, but this is just designed for people that are learning about this and trying to figure out what this local transmission means for Zika virus and blood transfusion in the United States. So that's the whole point. I hope it's useful for you, and I'll be quiet and let the interview begin. Well, hi, everyone. Welcome to a bonus episode of the Blood Bank Guy Essentials podcast. We are recording this on July 31, 2016, and we're kind of doing it in response to a large number of recent questions that I've gotten regarding the fabulous Zika virus. And with me on the call today and helping me co-host today is my good friend, Dr. Heidi Chaffin. Hi, Heidi.
Hi, how are you?
I am good, thanks. This has been kind of an interesting last few days with Zika, and I know you and I have talked on several occasions, and I thought maybe it might be a good idea. Well, I'll be honest. This was more your idea than mine because you're smarter than I am. To kind of go through some stuff about Zika for people out there, because man, we're getting a lot of questions. Are you sensing that too?
Exactly. Of course, Zika's been in the media a lot over the last few months, particularly with the Olympics coming up soon, and the athletes going to Brazil. But we've also have been dealing with Zika in the transfusion medicine community, and though there's been a lot about it in the lay press, there's also been a lot about it in the scientific press. And now I think with some of the cases, which we'll talk about, that have been found in Florida that seem not to be related to travel, I think it's becoming a very, very hot topipic in the transfusion community. So
for sure, that too. Committees and communities. Yeah. Absolutely, yeah. It's a big deal. So maybe we should just kind of take the opportunity to talk through this a little bit. This is not going to be a super long podcast. We just want to give you guys some basic information and hopefully answer some questions. I have to tell everyone up front, both Heidi and I are speaking on our as personal, private human beings. She works for an organization. I work for an organization. Neither of us are speaking in any official capacity for those organizations. And further, I need to make it clear that the organization for which I work is part of a research study that I cannot say much of anything about. So I'll just warn everyone in advance. A couple questions may come throughout this that I may have to say, you know what, I can't talk about that. So forgive me in advance. I will talk about what I can, but I've warned Heidi about this already, that there may be some things that we can't go into. Fair enough, Heidi?
That's perfect. Thank you. So, Joe, let's get started. And I know how much you love microbiology. so maybe just briefly tell us, what is Zika virus? What kind of virus is it?
Well, it is, first, it's not a new virus. I think that's something that escapes people. It's been around for forever. It's like 60 years. I think it was the 1940s. That would make it 70 years almost that Zika has been around. It was, I think it was first found in Africa, Uganda, if I remember correctly. And infections with Zika have been known for a very long period of time. Zika falls into the category of an arbovirus, which is basically any virus that's transmitted through an arthropod bite, like a mosquito or a tick, most famously mosquitoes, of course. It's a virus that's transmitted specifically by a mosquito. The mosquito species is Aedes aegypti, Aegypti. That's the most common mosquito that transmits it, but it's also transmitted by another version of Aedes albopictus, whatever. But Aedes aegypti is the primary vector of this. If that mosquito sounds familiar to you, that's because it's not Zika is not the only virus that's transmitted by Aedes aegypti. There are definitely other viruses with really fun names that can cause nasty diseases that are also transmitted the same way through Aedes aegypti bites, such as chikungunya virus and dengue virus, both of which are a big deal internationally, but not necessarily such a big deal in the United States.
So you pointed to the fact that probably the virus was first found in Africa, but where are some of the common areas where it's found right now?
Well, what we've seen recently, really over the last few years, because really up until not that long ago, the virus was pretty much limited to African countries, Asian countries to some extent. But we've seen a huge increase in the amount of Zika virus in the Americas, primarily South America, somewhat Central America as well. But really about, I think it was just last year, 2015 or so, that Zika first was found in the Americas, specifically I think in Brazil, the first case, but it's just undergone explosive growth in this half of the Earth over the last year and a half or so, with an incredible amount of disease happening. Now, really historically, honestly, that probably wouldn't have been that big a deal because Zika historically wasn't thought to be that big a problem. Typically, historically, what we'd see is that a lot of people, if not most people, with Zika really didn't have much in the way of symptoms. In fact, even today, we think that 80% of people with Zika are asymptomatic. That's pretty important to remember. 4 out of 5 people with a Zika infection are asymptomatic. But the ones that did get infections, the ones that did get symptoms, they'd have a fever. That's most common. But also a rash, joint pain, arthralgia, and conjunctivitis are the most common things that we would see with Zika. So not a massive deal at all. But the problem is that not too long ago we discovered a bigger issue with it, and that is the issue of transmission from mother to child.
Exactly, and that's sort of really what brought Zika to the forefront of both, like we talked about, lay press and scientific press. So you mentioned that it is transmitted through a mosquito bite.
Right.
Are there other modes of transmission?
So it would seem. Well, not so it would seem. Actually, it is actually proven that it can be transmitted through other modes. The most common other mode, in fact, the main other mode that we've seen, especially in the last year and a half or so, is sexual transmission. It does appear that Zika can be transmitted sexually, and it's kind of an interesting thing in that the virus in blood does not hang around for very long. Really a fairly short period of time on the range of weeks, and not many weeks. But it does appear that it hangs around in semen for up to, well, some people have said as much as 90 plus days, and can be transmitted sexually. Primarily, we've thought historically, well, recently, I should say, from men to women, because it is in the semen. But actually, recently in the news was report of a female to male transmission. So we don't really know a lot of details about that yet in terms of how long it might hang around in vaginal fluid. But there is that one reported case of female to male transmission of Zika as well. So sexual transmission does appear to be a definite way that Zika can be transmitted.
Got it. What about, is it transmissible through blood transfusions? Are there any reports of that?
Yeah, there are. There's nothing definitive in the medical literature about it. There were 2 cases, to the best of my knowledge at this point. I believe there were only 2 cases reported in the lay press in Brazil. but nothing definitive in the medical literature. But honestly, Heidi, I don't see any reason why it couldn't be. And there's a pretty good reason for that. I'm sorry I interrupted you.
No. I was saying sure.
There's a pretty good reason for that, and that's that we do know that both chikungunya and dengue can be transmitted through blood transfusion, and they're really very similar viruses. They do some different things in the body, but they're really very similar viruses. And if those guys can be transmitted that way, really there's no reason why Zika could not be transmitted through transfusion.
Okay, so Joe, I wanted to ask you a question. Since you work in a donor facility, so as you just mentioned, chikungunya and dengue, they're also they're very similar viruses, however you say the plural, and they have been known to be transmitted through blood, but in United States, the transfusion medicine community has not decided to take real large, big steps in terms of donor screening, etc. However, a lot more rigorous screening now of donors for Zika, which we'll get to. Why is that? Why is it that for Zika, it's become such a larger concern in our community?
Yeah, I think that's a really important question, and I can give you my opinion on that, but most of it is just my opinion. The reality is that up until we discovered the issue with the transmission from mother to child, up until that, really Zika was just thought of as kind of a nuisance, and really. Chikungunya, it can absolutely be pretty serious. Dengue, even more importantly, can be quite serious. They can get really nasty hemorrhagic fevers.
Exactly.
So it can be a very serious disease, but it hasn't been that much of an issue for us in the United States. Now, we have deferred people primarily for chikungunya and dengue basically by physical screening. In other words, if they're feeling okay, then they're generally fine. We haven't deferred them for travel. There was an outbreak of chikungunya in South Florida. I can't remember if it was last year or the year before, that led to some local deferrals of donors. But realistically, it hasn't been that much of an issue here in the United States certainly in terms of local transmission, not a whole heck of a lot. Again, just that one issue with chikungunya. And there's dengue in Hawaii, for example, and things like that. But again, not considered a major public health issue. But for Zika, the thing that really got people's attention is the long-lasting effects from that mother-to-child transmission. And we've been dancing around that. Let's get to that. We need to talk about that because the game completely changed when you started seeing stories of babies born with microcephaly. And that seems to be what Zika does with babies. When it's transmitted from mother to child, you get babies that are born with severe microcephaly. Basically, for those of you that don't know, it's really just like what it sounds. It's the brain is small and damaged by the virus, so it would appear, and as a result, the entire head is small for the baby. And this is a long-lasting, potentially devastating deal. Well, not long. It's a permanent. It's a devastating deal. Once that started happening, once we started seeing stories and horrible pictures and videos of babies born that way, really, I think the game changed. And we would be naive if we didn't recognize the fact that the public's view of this plays a role in how FDA responds to this and how the blood industry responds to this. This became an issue that was perceived to be, and I'm not criticizing it, really, it is a big deal. But the public perception became, wow, this is scary, that we need to do something about this. And as a result, the blood industry, I think, has responded in a way that is really, again, trying to respond to that, not only the scientific aspect of it, but also the public outcry aspect of it.
Got it. So as you mentioned, we haven't really had any cases of transmitted Zika in the United States. Mm-hmm. We're not even sure if there were more than maybe a couple in South America. Mm-hmm. And have we had any cases of, children born with microcephaly in the States?
Yeah, actually, there have been cases of children born with microcephaly in the States, but the issue is that the Zika was acquired not in the United States. It was acquired from travel to one of those areas in one of those affected countries that has Zika. And in fact, that's something that's important to recognize. You had mentioned the Florida thing, but up until the last week or so, when we started hearing about the Florida stuff, really the only Zika in the United States came from people that either traveled themselves to an area with Zika, and that's the primary, by far, way that Zika was acquired. In fact, I have the statistics for that. As of the 27th of July, so late last week, there were 1,658 cases in the United States. This is according to CDC. Of those cases, and that doesn't include the Florida cases, we'll talk about those in a second, the specific Florida cases we'll talk about in a second. So 1,658, 15 of those were from sexual transmission. One of them probably from a lab exposure, and I know there's one other in there that might have been from passed along from in a caregiver type situation, and I'm not sure if that's included in the lab exposure. Forgive me for not knowing that. But again, you've got 16 or 17 out of 1658 that were not from travelers. So the vast majority were just from people that traveled to areas with Zika and picked it up from a mosquito bite there.
Okay, and so the reason why you kind of wanted you to talk more to us about this is because obviously the blood industry, like as you mentioned, does see this as something that's important. But I also wanted to point out to the listeners that, as you mentioned, other viruses, including dengue, are quite dangerous. So I don't want to minimize what is the dangers of Zika. As a parent myself, I think it's devastating.
Yep.
But that as a blood banker and someone who practices in a hospital, it does seem like I don't want to get in trouble for saying this, but maybe the blood industry and the FDA has gone a little bit overboard about Zika, where there was never that much. I shouldn't say never, but there wasn't as much movement for some of the other viruses. But I appreciate that you are and everybody is doing what they can to make the blood as safe as possible. So let's talk about what is being done to assure the safety of blood.
Sure, of course. Well, over the winter months and in the early spring, when this was becoming more and more of an issue and we became more concerned with people in the U.S. Being infected with Zika from traveling to other places, both AABB and FDA came out with some ways to prevent this. And it primarily revolves initially around what I would call self-deferral. And really, that's just a pretty simple process. Someone comes in to donate blood, and they are provided with a list of risk factors, essentially, for Zika. And at that point, we're primarily talking about travel issues. In other words, they should self-defer for 4 weeks if they had traveled to any area where Zika was endemic. In other words, where local transmission, mosquito to person, of Zika had occurred. And that was the main issue. But in addition, not just the question about travel, but also they should self-defer if they'd been diagnosed with Zika, or if they had had 2 or more symptoms compatible with Zika, things like that. And then finally, the one that people forget about is the sexual contact with a man who in the 3 months prior to that contact had been in a Zika endemic area. In other words, sexual contact with someone who had traveled to a Zika endemic area.
Now, Joe, can I interrupt you? This is all still like in the pre-registration area? Like this is okay.
Yeah.
Got it.
Yeah, those were presented to the donors prior to them even registering. The idea being to keep them from actually ever getting into the system. Further, though, we actually did ask donors a particular question once they got through registration and as part of the formal donor screening process. And that one question was simply, in the past 4 weeks, have you been in any of those areas where Zika is being transmitted locally? Now, that was the only question that was required, and that's what a lot of blood centers did. But a lot of blood centers also included some additional questions kind of based on those self-deferral things that I mentioned to you before about sexual contact with someone who traveled with symptoms and being diagnosed with Zika in the previous 4 weeks, things like that. Now, to be clear, that one question being required was only required for areas without active transmission of the virus. If you happen to be in an area with transmission of the virus, which up until recently there have not been any in the United States, then suddenly you have some additional questions that you have to ask that are slightly different. You're actually asked about having a Zika virus infection. You're actually asked about symptoms of Zika as a requirement, and further, you're actually asked about having sexual contact with a man in that initial proposal for having sexual contact with a man who in the 3 months prior either had a Zika infection or had symptoms of Zika. So the questions changed somewhat in people who have in areas where Zika was endemic or where it was being actively transmitted.
Okay, so Joe, you just talked about how there's some questions that have been added to the DHQ, and there's some questions that we can do during registration or pre-registration to try to at least separate out the donors that may be at risk for having Zika, which, as you said, can be asymptomatic in a large portion of those infected.
Right.
But I'm also... I know that there is also some testing that's being done for Zika, and the reason why this has kind of come up for me is that recently, maybe about a week or two ago, the supplier that we purchased most of our blood from in my hospital sent out an announcement saying that we should expect to get some units of blood that may have an additional tag or additional label, or on the actual label some additional information about Zika testing. Basically, if it's been tested, that it's negative, and that it's negative by an investigational NAT. So apparently there seems to be some testing being done for Zika, and I just wanted to get a little bit of your input on, what tests are available. Are they FDA approved? Are they not FDA approved? And, where do we stand on testing?
Yeah, you bet. So I can speak more intelligently to what's going on in the donor world, but I'm aware of what's going on in the diagnostic world, and this is something that's important for our audience to be aware of. That donor testing and diagnostic testing are not the same. They fall under very different categories, and FDA approves them separately. So let's talk about diagnostic for a second. To my knowledge, and according to the FDA website, there actually is no approved diagnostic, meaning testing on patients, fully FDA approved diagnostic tests. Now, that does not mean that testing is not going on, because there's a lot of tests that are out there that are being done under what's called an emergency use authorization that FDA has permitted different laboratories and different manufacturers to allow their tests to be used primarily, essentially on an investigational basis. And what you're seeing is a lot of state health departments and CDC and other areas like that are doing testing on potential patients who've potentially been exposed to Zika and have potentially gained Zika from travel and potentially local transmission, as we'll talk about. So there is testing out there that's being done on a diagnostic basis, yes, but none of it is quote unquote fully FDA approved. They're basically all still being developed.
Got it. So then in terms of donor testing,
yes,
at least based on what I've heard and the blood that, my institution is expected to be receiving shortly, there is going to be some testing of donors, maybe all donors, some donors, we really don't know exactly. All we know is that we are going to be getting some blood that's tested.
Right.
And which is great, I think. if something is possibly dangerous to blood recipients or a concern, to test for it and to rule it out is great. What was a little bit troublesome for me was that I also heard and read that when these when these products that have been tested get distributed to transfusion facilities, FDA has recommended that an appropriate acknowledgement or consent be obtained prior to transfusion of high-risk patients, which they're describing as either pregnant women or, in utero transfusions of fetuses. And so my understanding is that, okay, we're going to, as a hospital-based transfusion facility, we're going to receive some units that may be tested. And if those units are to go to a pregnant recipient, or if those units are going to be used for in utero transfusion, FDA is recommending that we get an additional consent. I haven't seen any language as to what should exactly be included in the consent, and I'm sure different hospitals and transfusion facilities are going to be addressing that locally. But it's a little bit troublesome because I feel that it's great that we're testing, and I completely understand that it's not quite yet FDA approved. So, okay, it's not, all 100%. I don't even want to say not 100% accurate, but it's not FDA approved.
Right.
But if the unit is tested negative, and those high-risk patients are the ones that we want to assure that are getting the safest blood. And in my opinion, the negative units are the safest. But then getting them to sign a consent because it's still an investigational test, I think that it creates more fear in the recipient, because it's like the blood that's not tested, they just have to have that additional, the usual consent for, but the one that's actually tested now needs an additional consent. And in a high stress environment, a pregnant woman who needs to get a transfusion, so there's probably things aren't going optimally in the pregnancy. So there's already a lot of anxiety and stress going on. Here now we're saying, okay, we have blood that's tested, negative for Zika, but we do need to explain to you A, B, C, D, and have you sign a consent.
Right. No, you've outlined the problem perfectly, Heidi. It is definitely a challenge, and there are. This is where I have to be a little bit careful in terms of what I can say and what I can't say. But I will tell you that different places are interpreting that statement differently. The recommendation that an appropriate consent or acknowledgement be gained before going to a high-risk patient. I mean, fortunately, as you and I both know, it's pretty uncommon for a pregnant lady to get transfused.
Right.
So that's, granted, it happens, and obviously happens primarily around, most commonly around the time of delivery. But in terms of an early pregnancy transfusion, really rare. Intrauterine transfusions, really uncommon. So I'd be surprised if this scenario came up all that often in terms of the quote-unquote high-risk patients. But as I said, different places are interpreting this very differently. You mentioned something in terms of the counterintuitive feeling that, and I think that's what places are struggling with. Okay, so we're saying this unit has been tested, so that's great, but then we have to talk to the patient, or we're recommended to talk to the patient and let them know, hey, by the way, you're getting an investigational test, a unit that's been tested with an investigational test. It's going to feel to those patients like that's a higher risk product, when maybe, in fact, in most cases, probably it isn't a higher risk product. So it's challenging, and I understand exactly what you're saying, but unfortunately, each individual facility that's going to be receiving these blood products has to decide what this means for themselves. There's no further guidance that I'm aware of, and no specific language that's been put out by anyone, at least, again, not formally, to help people work through this problem, which I agree is a problem.
And, so I know that at least in my organization, we're going to have the next couple of weeks, have some meetings and decide exactly what approach we're going to take in terms of getting, a consent if these products are going to go to high-risk recipients.
Right.
We have not received any of these products yet, so we don't have any of them in our inventory, but we like to, have a plan prior to getting them.
Yeah.
And, I think something else is that we have to work closely with our suppliers and kind of as we get these units, if there's questions, maybe contact our suppliers and get more information. Would you say that's reasonable approach?
Yeah, well, I absolutely think that you should work very closely with your supplier, and I would say this to anyone: work very closely with your supplier to find out exactly how your supplier is implementing this testing, because there are different approaches that different suppliers are taking to implementing the investigational test. And that's, again, I can't say anything more than that, other than it's very important to understand very clearly how your particular supplier, if they're doing this, is doing it.
Right. So, that's what I think what we've been talking to our blood bank managers is that if you start receiving units that are tag labeled or have some sort of indication that they are negative for Zika by investigational NAT, to, let the medical directors know, and then we will be in touch with the suppliers to just get a little bit more information. But meanwhile, while we wait for the arrival of those units, we want to get kind of the additional consent process underway in terms of, having a workflow of exactly what we need to do if and so we choose to do this additional step.
Right. Right.
Because as as I mentioned, and as you, I think, reiterated, it's FDA recommends it. So it's not that, but, a lot of times when FDA recommends something, it's pretty much, everyone does it.
That's right. They recommend it. And if you don't do it, they say, why didn't you do it?
Well, exactly. So
let's talk about Florida. Let's move on and talk about Florida.
Let's do that, because things changed a little bit this last week. So we kind of figured we had the questions, and then a couple of weeks ago, we started getting a little bit more information about possible receiving some units that may be tested, or all units, or whatever, that we may have some Zika negative units. And then all of a sudden this week, we have some cases in Florida that, again, seems to change the game a little bit.
It absolutely changes the game. Well, we heard in my center, and kind of through the industry, I want to say a week or so ago. Again, we're recording this just so everybody, if you're hearing this later, it's July 31 right now. So this is what we know as of today. We heard about a week ago or so that there was a potential issue in Florida, that there may be some local transmissions of Zika in Florida. And that kind of scared everyone, because, again, up until this point, we'd thought that we were only seeing Zika in travelers and in people that had sex with a traveler. So we knew that something was going on, that the Florida Department of Health was investigating some cases in South Florida. But then all of a sudden on Thursday, Friday of this past week, we received word that, in fact, FDA was kind of moving forward, not just kind of moving forward. They put out what they call a piece of advice, and I love the way that's put. It's advice, FDA advice on what's going on in South Florida. And they basically said, and even before Florida had officially acknowledged it, they basically said we're treating this as if it is local transmission, and local transmission of Zika changes the game. This is something that FDA had mentioned, had outlined specifically in their guidances from earlier in 2016. But basically, once local transmission. In other words, a mosquito, an Aedes aegypti mosquito transmits Zika from one person to another person in a local area, and there's some criteria that go around that. I don't want to bore everybody with that. But once that happens, for blood collectors, the game changes entirely. You are basically, as a blood collector, you have to stop collecting blood in that area until you can either implement a test for Zika, which, as we know right now, is just an investigational test, or if you can implement pathogen reduction, a topic for another day, but basically post-collection treatment of blood to sterilize it, essentially. That's the very short version of pathogen reduction. Without one of those two things, you're done. You can't collect in that area at all. And so FDA basically said to the two, I believe, blood collectors that were collecting blood in that area of South Florida, you got to shut it down until you can get these things going. And further, for everyone else in the United States, you need to start asking people about travel to those two areas in those two counties. It's Miami-Dade and Broward County in South Florida. Again, to eliminate from your donor pool those that have traveled to those areas. And again, it was listed as quote unquote advice, but I'm not really sure what FDA advice means any more than I'm sure about what FDA recommendations mean sometimes.
Right.
But pretty much everyone realized we got to act on this.
And Joe, do you think this may expand to all of Florida?
Well, that's a good question. What has been stated in the press, and I believe this has been stated by the blood collectors in Florida, is that they plan on expanding it to essentially every area that they collect in Florida, if they have not already. I believe at least one of the two organizations that collects in South Florida is doing it for every person in the state. And in terms of whether there will be more local transmission in Florida, that's really anybody's guess. We've learned a little more. The Florida Department of Health put out something on July 29, which was 2 days ago, stating basically they believe that this was 4 local infections that occurred in a tiny little area in Miami-Dade County. That was just in the anybody that knows South Florida, the Wynwood area, just north of downtown. Basically, that it looked like it was local transmission just in that area, and they're saying this even though they couldn't find any mosquitoes that were infected with Zika in that area, but it appears that it is a cluster right there. Now, will that move on? Really, who knows? Most people in the United States, most epidemiologists don't expect Zika to have the explosive growth that it had in other parts of the world, just because of mosquito control activities that are much more advanced in the United States, people that are indoors in air conditioning much more in the United States than in other places. And chances are we'll see more. I think we'll probably see more, but it'll be sporadic as opposed to big explosive growth.
Got it. So I guess just to summarize is that the blood industry has taken steps to assure safety of the blood products. Of course, FDA is overseeing all of it. And right now, some of the things that are being done is, some self-deferrals,
right.
Questions added to the DHQ, and testing to some extent.
To some extent. Yeah, depending on the blood center.
Depending on the blood center. That is yet to be known. But I assume with all the... Do you think with what's going on in Florida, we're going to start hearing more and more about Zika?
There's no question. There's no question. And in terms of, there was a press conference on Friday that the head of the CDC held that was very widely attended. Dr. Tom Frieden actually spoke for a significant amount of time about Zika and this South Florida episode. And boy, news media organizations were all over that. There have been stories on Friday and this weekend about Zika in South Florida. And again, the only thing I know for sure is that things are going to change. But we wanted to get this out to everyone just so that we could kind of give people an update update because there are a lot of questions. This is not meant to be anything official other than just an FYI, just to let people know what's going on, because I'm getting a lot of questions about it through the website. What does this mean? What does that mean? Again, I'm speaking as me. I'm giving my opinions, as are you, Heidi. This is not meant to be anything official for anyone. It's just, this is the landscape as I see it right now, and obviously things are going to change.
Got it. Well, maybe we'll have to do like a Zika podcast too.
We might.
In a little while. But Joe, thank you so much for taking the time on a weekend to do this, because I do feel like there's a lot of questions, and as you said, not that neither of us can say anything official about any of this, right, but at least you as being at a donor facility, me being in a transfusion facility, we can kind of at least let our listeners know what we're hearing, what we're trying to do, right, and that there's a lot going on, and hopefully we can just make sure that the blood is safe and no one will get transfusion-transmitted Zika. That's the goal.
That's the whole goal. You're 100% right. Heidi, I appreciate you having the idea and for, bugging me. I'm sorry, encouraging me to do this. Much appreciated. Thanks so much.
Thank you.
Hi, it's Joe again with a couple of closing thoughts. After you record a podcast like this, when it goes, you do it fairly quickly. As I'm thinking about this later, there are a couple things I wish I had pointed out, so let me do them now. First, I mentioned that the pregnancy and intrauterine issue with Zika is a very large deal, and there's no question it is. And I was remiss in mentioning that, in fact, there is another issue with Zika in that a very small number of people that are infected with Zika appear to get Guillain-Barré syndrome, the paralysis syndrome associated with many different infections, not just Zika. I didn't mean to discount that. And then the other thing that I wanted to mention is the fact that, and I didn't make this clear, that the Aedes mosquito, both Aedes aegypti and Aedes albopictus, are in fact in the United States right now. They're fairly broadly spread across the southern half of the country, all the way from one coast to the other. And so the possibility of local Zika transmission certainly has always been there as a possibility. But the thing that epidemiologists tell us about those mosquitoes is, first, they don't fly very far. They have a fairly limited range. They're not cruising for miles and miles and miles, so they would tend to be very local in terms of people that they infected. And also, they have a fairly short lifespan and a fairly short lifespan after they get infected. In other words, it takes a while for the virus to become infective in them once they are infected. So again, it's a fairly narrow window of opportunity for them to spread the virus. And that, and the fact that, as I mentioned in the podcast, the local mosquito control, the way our population has a tendency to live more in air conditioning than other countries, are other reasons why we don't really expect it to be explosive growth of Zika in the United States. So I just wanted to make those two things clear. Again, I hope this was useful for you. This podcast probably won't stay up for terribly long, simply because I know things are going to change. And when they do, we'll try and give you some kind of a heads up and some kind of an update on this podcast. So as always, as you go through your day, I hope that you smile. I hope that you have fun. And above all, never, ever stop learning. And we'll catch you next time here on the podcast.